Well, welcome everybody to Thrive in Your Body with Homeopathy, a series where we discuss what homeopathy can do for you and your loved ones, especially if you're suffering from a chronic health condition. And I'm so honored and so excited to welcome our fabulous guest today, Sarah Valentini, all the way from Melbourne, Australia. Let me tell you a little bit about Sarah before I introduce her to you. So Sarah Valentini is the director of the Family Apothecary and is a qualified classical homeopath and intuitive healer. Having been in private practice for over 15 years, she has a special interest in working with children and women. She has worked with many families in managing their child's health in an integrated model and has a great interest in developmental and behavioral disorders such as autism, PANDAS, ADHD, sensory processing, tantrums, emotional dysregulation, and rage. Sarah has been involved with launching the School of Intuitive Homeopathy as well, an online course for parents as well as for homeopaths and doctors who want to learn more about the intuitive approach to homeopathic prescribing. Sarah has also worked extensively with women's hormonal complaints, including thyroid disorders, PCOS, endometriosis, and perimenopause and menopause. Her passion for working with women and mothers stemmed from a need to support the mothers of the complex children's cases. Drawing on her long-term experience with meditation and her own personal journey with homeopathy, nutrition, and psychotherapy, Sarah has a unique approach to working with her clients, using her knowledge of whole body healing, pathophysiology, and detox, combined with a heart-centered approach. Her goal is to get to the core of the issue, leaving no stone unturned when it comes to diagnosing and treating her patients. Sarah lives in Melbourne, as I said, with her husband and 2 children and her dog, Uno. All right, so let me bring Sarah over and welcome. I'm so honored, so excited, and so looking forward to speaking with you, Sarah.
Thank you, Monica. Thank you for having me.
Beautiful. Okay, so let's jump right into the questions. And, I really wanted to start first with your own journey and how you got into homeopathy, because you have such a diverse background. So tell us a little bit about, what made you a homeopath and what made you also to stick with it and create such a, thriving and successful practice.
So I was always naturally drawn to natural medicine. And when I was studying, I learned about naturopathy and I wanted to be a naturopath. But I went to a very academic private girls' school and I was steered away from naturopathy and actually told, no, that's never going to be a proper profession. You should consider medicine or something like that. And I was thinking, I don't want to be a doctor. What do I do? Anyway, I studied science and I didn't really enjoy that much at all because it was it was just pure science and that didn't really engage me. And so I went and did some other things and then I traveled around the world. And it was when I was living in Amsterdam in 1998 or something that I got a cold. Actually, I think I had a sinus infection and a cold. And my boyfriend at the time went to the pharmacy there and came back with these little vials of these little white pilules. And I was like, okay, well, I don't know what this is, but I'll just take it. And I'd always been really sensitive to pharmaceuticals, so I really avoided taking any medication. But anyway, I took these remedies as they were, and my symptoms just resolved and I just got better and there was no side effects, which is why I would avoid pharmaceuticals. So I was like, what is this stuff? And I saw on there that it was homeopathy. And then fast forward a few more years, I was back in Australia and I had my first child and he wasn't sleeping well and he had this severe nappy rash. And somebody said, oh, why don't you find a homeopath? And it was very hard to find a homeopath back then. It probably still is in many ways. But I found a homeopath and I went to him. And so he prescribed, and I just loved the way that he took the case. Like he just was so thorough. And I got to talk about everything. I got to talk about the birth and I got to talk about you know, my son and how it presents. And so it's like he really wanted to know, not just, oh, this is happening. And I'd been to other doctors and things with my child because he wasn't sleeping and all of that kind of thing. So this was quite fascinating to me. And, you know, throwing back to my experience in the Netherlands with homeopathy. So I took my son to him and he gave him a remedy. And my son was having this blistering nappy rash, and virtually my son would do a poo, and within a minute, his bottom was blistering. So the homeopath gave me a remedy for that, and also for the sleep and things like that. And but the most impressive part of it was that I would give him, he would do a poo and he'd start screaming. I gave him the remedy, and I'd seen his little blistering bottom. And I virtually saw his bottom heal up, like straight away. Like within an hour, he had no blisters, which was just like, what is happened here? It was incredible. And so that just like kind of really got me interested. And then a friend said to me, oh, you should think about studying homeopathy. It's like, because I was probably talking about it. I was like, oh yeah. And I was at the point of kind of changing from my previous career. So I thought I might just do that for interest. And the first lecture I went to at the college that I studied at, I was just like, wow, this is amazing. I was just hooked in. And so I finished my bachelor's degree in homeopathy, and here I am.
Wow. Yeah, it's, you know, what's amazing about homeopathy, sometimes it's almost hard to believe because it works. If it works so fast and without any side effects, without any, you know, additional negative things that may have happened with, you know, other medications. That I think that also kind of makes it hard for people to actually believe that it works.
Right.
Right.
Yeah.
But I think that, you know, the more we talk about it, the more we can actually create trust. And, you know, this is probably one of the reasons why I want to interview you, to actually help women to trust that they can help their children. So
Yeah.
let's talk more about, you know, how you actually work. And we talk about integrated model of healing. Can you tell us more about what does that mean, and how does that work with pediatric cases, and how does that fit with homeopathy?
So, you know, in terms of like, I mean, I have blended in the cases that I work with, I blend a lot of functional testing at times. And I think it's, you know, sharing information between modalities, so to speak. So, you know, I have worked with psychiatrists, I have worked with pediatricians as well. And to get this kind of whole understanding, mind you, one of the amazing things about homeopathy is that there is no interactions between us and what somebody else does, really.
Right.
I mean, we can do, you know, somebody could have acupuncture and that's an energy medicine, and that can, you know, we can see some crossovers, but really we don't need to be too concerned with what everyone's doing. But in the same way, it's important, especially with the kinds of cases that I work with, to either have a team or to be holding space for these children from many different angles. So when we talk about an integrative approach, you know, I like to have contact with their pediatrician or the psychiatrist in some cases as well, and understand what's happening there. And, you know, at times there's some quite extreme behaviors that may need medication, but my goal is always generally that we can bring that child back into balance and get them off medication if they're already on it. But for some of the conditions I treat, such as PANS and PANDAS, you know, there's a whole lot of complexities around medication because it doesn't usually hit the root cause. And often if it is something like antibiotics, it's almost palliative, because taking antibiotics for 7 or 8 months, even though it may take away symptoms, will then lead on to other complications because of the imbalance in the microbiome that's as a result of taking long-term antibiotics.
Okay, so you really, you know, on one hand, you know, homeopathy, I think it was really important to stress that homeopathy will not interfere with medical treatments. right? And I think that may create more trust in women to actually try it. But can you tell us more about what are the factors that actually create that ill health in children that as homeopath you can actually recognize, and maybe that are under the radar of a conventional medicine? Can we talk more about that?
So this is something, after seeing thousands of patients, there are some factors that I'm seeing. And even over the years that I've been in practice, there is a change in, like, when I first started in my practice, I didn't see every second child, like, for someone to have had steroids, it was a bit more rare. Whereas now it's almost every second child has at some point been prescribed a steroid drug. So this is interesting. This is a big change. And exposure to drugs like that has an effect on our vital force. So our vital force is what we talk about in homeopathy. It could be somewhat like the immune system, but it's not just the immune system. It's also the energetics of the immune system, so to speak. So what I do know is that we are having a decline in our child's vital force or immune system due to a lot of factors, such as pharmaceutical interventions as babies, vaccines, the over-vaccination of our children, toxins that are in our environment. We are all exposed to toxins all the time, and it's more and more and more, and it's hard to avoid. And we do our best really with that. But the children are the canaries in the coal mine of what's happening with all of these exposures and, what we hand down as mothers to our children. It's just layering on top of each other. Glyphosate on our conventional plants, or it's just in the soil, heavy metals, EMFs even are an intervention that actually interferes with our body's normal immune response. And most of the conditions I'm working with are with children who are not having normal immune responses, which is they get an illness and they recover. They get an illness, they have symptoms and they recover, actually. So most of the children that I'm working with, we're seeing like chronic states from early ages. I mean, even asthma and eczema are generally a chronic state. Allergies that come up in children. And then, of course, autism, PANS and PANDAS, even ADHD, where there's so much distortion going on. And this kind of leads to, we have our gut microbiome that's being disturbed, but our nervous system in general is being disturbed. Our children have leaky gut due to all of these interventions. That leads to other leaky tissues too. That leads to a leaky blood-brain barrier. The blood-brain barrier is the filter to the brain. It's supposed to protect us. But when it's leaky, when it's open, things can cross over. And that's when we can see the worst kind of symptom presentation of a disordered immune system.
Okay, so how does homeopathy actually come into picture here? Because, it can sound overwhelming. How can we not have all the toxins in our life? How can we actually stop all the medication if it's so harmful? But then homeopathy doesn't actually ask us to do that. I think it's actually helping in these conditions that we are in. Is that correct?
It is. I mean, ideally we avoid as much as possible. But the thing is, like sports fields and things are sprayed so heavily that if your child is playing sport and they're rolling around on the grass, and their skin touches that grass, they're getting some toxins through that. And you don't want to stop them from being involved in the world, because actually some of my most complex cases with PANS and PANDAS are kids that can't go out there anymore because everything's broken down so much that they're affected and they get symptoms straight away. So we do want to have a healthy relationship with our environment, but we don't want too much. So, there are choices we can make as parents for what we do with our children, choices in terms of even knowing about homeopathy for acute illnesses, because every time you would treat your child for an acute illness with homeopathy, you will strengthen their vital force. Absolutely. So this is like, your child has the flu and you can give them belladonna or euphrasia or eupatorium or whatever it is. I mean, it could be euphrasia. So every time we treat acute illnesses with homeopathy, we strengthen our children. So homeopathy for acute illnesses, or another kind of natural supportive medicine that doesn't go against the vital force, that doesn't try to just shut down symptoms without them being expressed. Reduction as much as you can to the exposure of toxins. So whether it's through your food, the grasses, the sports grounds and things like that. Taking your shoes off at the door where you might have walked places that have been sprayed, that kind of thing. What we can do with homeopathy, though, is we can use homeopathic remedies to actually detox these substances from the body. And this is such an incredibly powerful part of homeopathy, I think, because we can detox, I could say virtually anything. And it's very specific detox. With natural medicine, we can use things like glutathione or NAC, or there's many activated charcoal, bentonite clay, zeolites, this kind of thing to detox. But homeopathy is super specific. So it will go to where it needs to go. So whether it's a vaccination, steroids that have caused an effect, whether it's glyphosate that's in the soil, we can go directly to those things and see some pretty amazing changes when we work like that.
Mm-hmm. So you're actually saying that homeopathy can help with neutralizing the impact of the toxins and medication.
Yeah, and remove them from the body. Yeah, heavy metals too. I do that quite frequently. Yeah.
Mm-hmm. So would you advise for a person who, has a child who, has a complex diagnosis and they've been treated by conventional medicine for a long time, how would they go about it? How would they actually approach homeopathy to start with? Would that mean to actually start with detoxing? Would that mean to start with just sort of gently supporting the system? How do you work with that?
That's a really good question. It really depends. So homeopathy is always individualized. So I don't work with a protocol, and neither do the other consultants who work with me. I am working with whatever needs to be treated with whoever comes. Okay, so always we're giving a constitutional homeopathic remedy. So which fits the totality of the case. And this means, some of the history and how their symptoms present, how they are in the world, or what they're like when they've got their symptoms. And then, so that, to me, that's an essential kind of cornerstone of treatment. But we may look at, for example, if somebody's had a heavy steroid load or taken a lot of steroids, we generally would start with detoxing steroids. And that means taking the steroids and making them into homeopathic potencies, which are dilute, very dilute. So what we do then is we are giving that steroid in the homeopathic potency, usually in a bit of a protocol, in ascending potencies. So that means the potencies go a little bit higher each time. And the reason, for example, that we'd start with steroids is because steroids are very suppressive to the immune system. I mean, we use steroids to shut down the immune system. That's their job. And that's it. So, when we need to suppress the immune system from having a reaction, it's certainly not solving a problem. And when somebody's had a lot of that, you can imagine that their immune system is pretty shut down. And we need to remove that layer, because actually I've found in many occasions that even a history of heavy steroid use is an obstacle to cure. So, which means that it's an obstacle to the immune system actually getting better. So it's not always the case, but I do find it to be incredibly effective to start with that. And then it's just to see what's the most important thing. Whether it's if strep, for example, has been at play, and we see strep a lot in the cases that I work with, then we would give strep as a remedy as well, like we would with the steroids. Again, it's strep made into a homeopathic potency. Now, this works differently than antibiotics because obviously strep is a bacterial infection, and often in Western medicine they give antibiotics, which kills. We don't kill in homeopathy. We're never killing. But what we are doing is we are creating a balance between my body and the strep, because actually we have strep in us and on us all the time. It's when we're really sensitive to it that it can cause a problem, or when we get it, when it has an opportunity to cause an infection, so to speak. So the reason it has an opportunity is because there's some part of us that is open, susceptible, weakened even. Weakened is a really important word here. And so when we give a homeopathic remedy like strep, which is known as a nosode, so it's made from a bacteria, and nosodes are made from diseased tissues. It is, to me, what I observe is it's like telling that bacteria, oh, we don't have to be at war. I see you. It's okay. So it's almost like making peace. You know, the antibiotic movement actually made war on bacteria. It made the bacteria the enemy. And that we don't do that in homeopathy. We're not making it the enemy. We're equalizing it, because actually it does live within us all the time. So it's more about that. It's more about letting the body know we don't need to react to this all the time. And so it's quite amazing to see the shift in people and their susceptibility to having strep type illnesses when we give the nosode. It could be another remedy, but the nosode is one way. But as I said, homeopathy is always individualized, and we give the remedy that's appropriate.
Yeah, that's a beautiful model. It's kind of creating harmony and resilience within the body, instead of trying to fight something external, which is such a huge shift. And that's just why it can be sometimes hard for us, I think, to actually enter homeopathy, because it's a completely different mindset. But going back to steroids, I'm curious. So, say a child was, exposed to large doses of steroids, and the immune system is shut down. When you give that homeopathic steroid in potency, is it possible that the immune system there's a backlash, that maybe there is more infection or more symptoms that initially come in? Is it possible?
It's possible. Yes, it's possible that what we'll see is an aggravation or the immune system kicking in. And usually at that time, if it happens, and I will say I haven't seen it very much, if that happens, then we support that with homeopathy. But what I've also seen with steroids, and I've had people on steroids for 30 years that I have managed to get them off with the detox and then supporting them. Steroids actually can also maintain a cycle. So if we think of eczema, for example, and we put the steroid cream on and the symptoms go away, but then they come back up again. So we put the cream back on and the symptoms go away. And it's like, it becomes this fight. And so it's just me versus the steroids, or my eczema versus the steroids, is who can show up faster and stronger. And what I've found is that when you give the steroid detox, you actually remove this fight as well. You remove this conflict. And I've seen people, their symptoms just resolve, and it's almost like the steroids were maintaining the symptom. Now, I don't take this lightly. I do want to say that too, because sometimes people are on steroids for a reason, and they've been on them for a long time for a reason. And I don't ever say to anyone, stop the steroids, let's do this. Never, ever would I do that, because that you could have that backlash. And also you want to know that the vital force is strong enough, and that you're gently kind of coaxing it back to itself in a way. So it's something, you know, you should do with a trained practitioner who knows what to expect or knows how to support you if anything was to come up. But generally, I've definitely seen this kind of tug of war with steroids and steroid use.
Yeah, that's fascinating. And obviously, we have to use our reason. And if there's been a lot of medication involved, we can't just take people off of it. We have to be sort of gradual and slow and watch the body and individualize. I think that that's so important. That is missing in conventional medicine, that you as a homeopath, you look at your patients as individuals in their own, very uniqueness. So I think that's what makes homeopathy so potent and so powerful. Right. So I would like to kind of talk a little bit about the diagnosis that you treat. And because I can imagine you have a lot of patients who come in, moms who bring their children, or dads who bring their children, diagnosis. So what kind of illnesses and conditions you treat, and where is homeopathy the most beneficial?
Yeah, so I work with complex pediatric cases that cover autism, PANS, PANDAS, ADHD, ADD, any of those acronyms, really. That's quite an umbrella. So across all of those diagnoses, there are some common threads. And those common threads are a disordered immune system and a dysregulated nervous system. Both all of them. So autism, PANS and PANDAS. And maybe I should speak about what PANS and PANDAS is, because often it's something that you don't know about. So PANDAS actually was found or discovered, I guess, by a doctor in the US called Dr. Susan Suedo. And she found that there were children presenting with neuropsychiatric symptoms such as tics, major anxieties, OCD, ritualistic behaviors. And she actually found that strep in each of these children was at play. And so there's a lot of research that she has done about this relationship with strep and Tourette's, tics, motor dysfunction, and ritual OCD behaviors, anxieties and things like that. And so a lot of research went into that. And then they found that it wasn't just strep causing these issues in children. Actually, it could be a virus. And underlying that too, or any pathogen, it could be even parasites. And underlying that, we have things like yeast and mold that can also contribute to this low level of health. So across autism, PANS and PANDAS, ADHD, and all of these diagnoses that I mentioned, there is nervous system dysregulation and a disordered immune system. So all of them are not responding well to a pathogen that may come into their environment. And some of them may get sick and some of them may not get sick, but some of them will show behaviors. So even in autism, like when I see children with autism that are stimming, so stimming is doing some kind of repetitive behavior, whether it's rocking or, doing things with their fingers or flapping, all of these things are actually for them to help regulate their nervous system. But we see in PANS and PANDAS, we'll probably see more like ritualistic behavior. So we'll see rituals. So I have to do things in this order. I have to wash my hands for this long. I have to, every day, this is how it goes. And so it kind of can present like rigidity, but often there's a lot of anxiety around it. This crosses over with autism. We see this in autism too. And with ADHD, we see a lot of restlessness or inability to focus and concentrate. And the inability to focus and concentrate can often be related to neuroinflammation, so inflammation of the brain and nervous system. And when there's inflammation of the brain, if you were to think about it, inflammation in the brain, it doesn't help children to think very well. It doesn't help them to plan things out, and they can be impulsive, or they can't do their schoolwork. We see a lot of crossovers with restlessness in autism and PANS and PANDAS and ADHD. So they're constantly moving, and they can't sit still at the dinner table. They can't stop moving around as well. Or we could see the opposite, which goes into complete lethargy and they can't move, and their body gets so tired. So this is the crossover amongst all of these diagnoses, actually. And so I became really interested in these because actually my son had PANS, and I really wanted to understand, because the classical homeopathic approach was not helping him. I was already a homeopath, but I was taking him to see other really wonderful homeopaths, and he would get a little bit better and then not completely get better. So, like a mother who with a huge kind of drive and passion, I really wanted to understand this. I wanted to understand children's behaviors in general, and then how homeopathy could help them, because I always really felt that homeopathy has the answer. I just knew in my materia medicas there would be the answer, but there was so much more depth of understanding that I needed. And so I kept on looking and studying those kinds of about all of the aspects of this, and in my practice, just seeing patterns over and over. Like, I see that in autism, but that's similar in PANS, or ADHD, and that's similar in that. And looking at all these patterns and understanding the pathogen involvement, or the heavy metals, or the mold even is a huge thing. Then I kind of can see actually how all of these things fit together.
Okay, yes. So you're really tracing what are the commonalities versus the diagnosis. I think the conventional medicine often, wants to kind of box different diagnosis and have this is this disease, this is that disease, and that's how we treat it. Instead, in homeopathy, we're looking for commonalities and what is really underlying the issue rather than, the label. That's what I'm getting. Mm-hmm.
Yes, exactly, Monica. Exactly. We're looking at because the label is, the label is the label, but we always look at these kind of patterns. We look at even within the label, how does this child present?
Yeah.
How what because we can have one remedy that fits a child with the diagnosis of autism, and it may also fit the child with the diagnosis of PANS, PANDAS, or ADHD. It'll present slightly differently, but there will be threads that go between all of these things, all of these diagnoses. But definitely in amongst all of them, there is this disordered immune system, that's not having a normal immune response, and then a dysregulated nervous system. Like a sensitized nervous system in some way. Yeah.
Yes. And I think for moms who may be listening, I think this is so important. Your child will be treated as an individual. It will be looked at as a unique person that is going through their journey. And unlike, in sort of conventional medical a treatment where you just get your medication and you go home and hoping that it will help, not really knowing if it will. This is a very different system with homeopathy. So I think this is important to just emphasize and stress for people. Very well. And speaking of which, you also, I think an important part of that really got my attention about your work is that you also treat women and the whole family, that there is this aspect of the health of the family that enables the child also to heal. Can you tell us more about it? How does that work? And how would you explain that?
So I have talked to people about healing the family nervous system too, because if we expect just the child to change, but the whole family's nervous system's dysregulated, then it can't be sustained. And sometimes the whole family's nervous system is dysregulated because of a distressed child. But sometimes that distressed child is also, it's a gift to parents to do some healing themselves. So that's one aspect. So we would look at the whole family nervous system, because sometimes, the stress, it starts going around. So the child sets off the mum, sets off the dad, sets off another child, and it kind of goes round and round. And so we need to kind of assess, how's everyone doing here with this situation? We really need to hold and validate and acknowledge that. With the mothers, one of the reasons I started really working with hormonal issues, I mean, actually in the start of my practice, I had a lot of success with hormonal issues anyway, but one of the other reasons I started to work with, because I was working with mums who were often in their late 30s and 40s, and they had these complex children situations. And so it's very, very, very stressful. Often it's exhausting, often sleep is disturbed, and there's high needs, there's high demands on the mother. Now, what happens with that is that causes a hormonal cascade to happen. That level of stress ongoing causes a hormonal cascade in women, in mothers. And from that situation, a mother can stay in an adrenalized cycle where she's constant, where she might not be able to sleep. She can't wind down. She's a bit startly and panicky at times because she's had ongoing stress. And then that can start to lead to physical symptoms too. So it's so important, because if we need to make sure she's got the life mask on too, or first, before, so that she can also be there and support her child. So, in that way, it's really important to kind of support that whole system, to see the mother, to see her grief as well, because, there is so much grief that these mothers endure. First of all, having a child with autism, getting that diagnosis can be a death sentence. I want to say that often we need to really embrace the gifts of our children, even with a diagnosis too. But it's a shock. Let's acknowledge it. There is a grief. There's a grief of what could have been and what may not be. There is a grief that your child might be isolated in school or not be able to attend school in some cases. And so that sadness, it's very real, and we can support the mother just with beautiful homeopathic remedies. Even one remedy such as Ignatia can be incredibly helpful for mothers ongoing, to help them keep supporting their children through all the ups and downs.
Okay, that's beautiful. So you're really treating the mother as you're treating the child. And I would say it kind of works in synchrony, where one healing kind of enables the other one to heal as well. And I love what you said about the gifts that children who may have the diagnosis, that are difficult, can bring to the family and bring to the parents, as the sort of motivation to look into our own health and improve our own health as well, which is a wonderful way to look at that. I think it's very helpful. And
yeah.
Great. So I would, I know that there's going to be moms who are watching this or listening to this podcast and wondering, but how would that really look like if I went to a homeopath? What does it involve? Am I going to be given a lot of different pills? And am I going to be asked to do certain things? Like, how does it? Can you tell us, an example of somebody you treated that could bring it kind of more down to earth, so people can understand what it looks like?
Mm-hmm. So for me, in my practice, I send out a questionnaire before I see children, and a questionnaire for adults too, but that's generally a lot shorter. And the questionnaire covers things like, does your child have any fears? Is there anything that makes their symptoms worse? I also ask if there's a professional diagnosis and all of the things that they've tried before. I will ask what happens when your child, when your child feels anxious, how is their sleep? And I really dig down, and as homeopaths, actually, we really know how to dig down into our clients, like no other modality, I think. There are times when parents have said, oh, seems a bit more like a counselling session. And sometimes it is a bit like that, especially when we're dealing with behaviours as opposed to just physical symptoms. But we'll find out, does your child feel the heat or the cold more? What do they like to eat? Just naturally, do they like to eat? What kind of foods are they drawn to? What kind of foods do they really not like? Does the weather affect them? All of these kinds of things are general symptoms that we'll look for, and then we'll go for really solid specific symptoms and behaviors. So when we get the questionnaire, and then we generally review that and see, okay, where's the Where's the focus of this case? What do I need to know more about this child? And so the initial consult from me and the practitioners that work with me is an hour and a half. And we go through all of these things. We even go through your pregnancy with the child, before the child was born. We go through a family history to see if there's any patterns as well with the family history, which is very important too. And it is very thorough. So we really ask you to tell us about your child. Sometimes I'll have people that come that have been to all the functional medicine doctors, naturopaths and things, and they'll come and tell me what the test results told them, which is important. But actually, I also want to know about your child, not just what the test results have told us. I really want to know what they are like. Are they affectionate? Do they not want hugs? If they have a stim, tell me about their stim. Show me what it's like. I want to know the details so that I can understand what it's like for the child and why they're doing those behaviors. You know, some children that rage, for example, I want to know like what that rage is like. What's the quality of it? Is it like, do they just have a quick rage and run away, or do they stay in it and front up and not let it go? You know, all of those kind of details are important for us to know as homeopaths in order to prescribe an individualized remedy. So generally I prescribe liquid remedies. I prefer my clients to take them in liquid, but we can take them in pilules, the little white pills. And generally they may have 2 or 3. And so I'll be supporting different aspects, whether it's we're clearing, steroids, for example. We've talked about steroids a lot, or whether we're working with an infection, whether we're working, there's always a constitutional remedy. So that's the remedy that encompasses the whole patient. And sometimes I'll also be working on supporting, if there's any constipation or diarrhea or any gut issues, or helping support the liver and the kidneys to detox what's in the body. Whether it's a particular remedy for the skin or any other particular physical symptom as well. So that's all supported. Some homeopaths only prescribe one remedy, and I don't do that unless one remedy is what is needed. But again, it's individualized because I am looking at many different aspects, and I know from having a child with PANS that we can attack the issues from a few different angles with homeopathy and do no harm to the patient as well.
Mm-hmm. Okay, but I think it's important that homeopathy does not harm, because it is so subtle and diluted and gentle on a body. I think that's the principle of homeopathy. It needs to heal gently and without creating side effects, right? So that's very important. I think for people, we all used to conventional medication where side effects can be tremendous and really very inconveniencing or actually harmful. So this is, again, a very different approach, a very different outlook on healing, which I really would love for everybody to understand. And can you give us an example of a child you treated that maybe stands out for you?
Oh, there's so many. There's been so many that sometimes it's hard to pull. But I have a case of a child with PANS who actually was doing very well on the prescriptions that I'd given. But the family moved into they sold their house and they had to move into an Airbnb. And the Airbnb had mold in it. And interestingly, this triggered, because mold is very dampening to the immune system. So, and it triggered the child to start clearing their throat all the time and to have a PANS flare. So a flare is, these children aren't often always in this state, but when they're exposed to the pathogen, their symptoms get worse again. So he started clearing his throat a lot, and I gave him 2 remedies. I gave him strep because strep had been something he'd had in the past and that we needed to revisit. And I gave him actually a remedy from the common housefly, actually. And because it was like, actually the mother said she felt like she had a fly in her throat during the consult. So it was a very strange thing. But there were also some of the behaviors that he was actually being quite negative about himself, self-deprecating, which we can see in the remedy strep, but also in this remedy. It's called Musca domestica, and it's the housefly. And so he was living in this moldy house temporarily, but these symptoms came up because these kids are sensitive, and those two remedies completely made the throat clearing go away. And also he wasn't so negative about himself for a period of time. So actually, I don't think I've seen that since then. I still see this child because this mother is often, with these complex cases, it's not just one visit. It's not just one remedy and then the problem solved. These are chronic, complex conditions, and we are trying to get the immune system back online. So I still see this child, and he's had a lot of wonderful remedies over the time that actually just have shifted his symptoms like that. So this throat clearing in this case completely went away, as well as his self-deprecation. He was saying, I'm no good, all of this kind of thing. So we can see that we can shift that emotional state as well as the physical presentation of the symptoms with homeopathy. I mean, that's what we aim to do. We aim to see the child back in a state of balance where they're not kind of talking about themselves negatively or raging or just depressed or any of those kinds of things.
Okay, well, yes, thank you for that. I think that's so important, that it's really, again, looking at the whole person, emotionally and mentally and also physically at the same time, which is so important.
Yes.
Very good. So, Sarah, you're also involved in with several different organizations, and your homeopathic practice is called the Family Apothecary. Is that correct? Yes. And then, but you're also involved with Homeopathy Hive and the School of Intuitive Homeopathy. Can you tell us more about those organizations and who they serve?
Yes. So the Family Apothecary is my clinic, and I have 4 other practitioners working with me. And 2 of those practitioners I'm mentoring. Actually, I mentor all of them, but with working with complex cases. And the other 2 in the Family Apothecary are working with everyone else that is coming and that wants to be supported, and general children's issues and things like that. Homeopathy Hive I co-founded with Bridget Biscotti Bradley and Angelica Lemke. And this is solely for complex children's cases and their families. So we have a team of 7 of us, and we are all working with and treating these complex cases. And we all get together and we talk about them and, understanding. And we do have a particular way that we are working. We all use some intuitive approaches. We look at the integrative approach and functional testing and whatever we need to do, really. But it's a great hub and support for families that have a complex child. And we have a lot of wonderful, amazing success, which is what drives us all to keep doing it. And the School of Intuitive Homeopathy was originally was founded by Angelica Lemke, and I am teaching in the school as well. And I've been teaching in the school since it was established into its current presentation as well. And so we teach practitioners and people who want to be homeopaths, who are interested in in working with to be a homeopath. We have a certification program as well. I also teach occasionally with some other colleges too, and I love teaching and speaking and bringing, because actually I really want more practitioners to know how to work with complex cases, because as I said, my son had PANS and I took him to see many different really wonderful practitioners that practiced in a classical way, but my son did not get better. And it wasn't until I introduced this other way of working that he moved forward. So this is my passion. This is my, I want, because there's so many kids out there, Monica. We have a pandemic actually of children with neuroimmune disorders. So where the nervous system, immune system's disrupted, all the acronyms that I've talked about, all those diagnoses. It's a pandemic. And we need many more practitioners out there that are working and know how to work with these diagnoses.
Yes, that's wonderful that, you know, you are actually spreading this knowledge, not just by treating children, but also teaching. And what I understand is that mothers can also join courses and start learning and actually help the children on their own. Yes?
Yes.
Okay.
Yes. And mothers are, I have to say, you know, nobody knows your child like you do. And, you know, you are incremental in their healing. So supporting yourself and also educating yourself on what you can see and what you can do and all of that kind of thing.
Right. And I would imagine that, you know, by educating yourself, you become a better patient and probably the results are better as well, even if you're working with a professional homeopath. But also, you know, how wonderful to be able to help your child, you know, maybe with an acute illness that happens because you know how to do that by just educating yourself and also help yourself. So I would encourage everybody, I'm going to share all those links. So please check them out and check the School of Intuitive Homeopathy and as well as, you know, the other organizations, and would love for everybody, you know, to consider, you know, starting to learn more. And hopefully this, you know, podcast will help you kind of tip your toes a little bit and understand a little bit of the basic information about homeopathy and how it can help you. Wonderful. So, Sarah, do you have anything that you would like to add? Maybe how would you encourage, you know, yes, tell me.
Yeah. Just when you were speaking then, I was thinking, you know, so many people's minds get in the way of trying homeopathy because of the negative viewpoint that can be out there in the mainstream. And I can't tell you, I mean, I have so many patients that come to me as their last resort because nothing else has worked. It's, you know, it's such a huge part of being a homeopath. I think we see the cases that nothing else has helped. But just try it. You know, a lot of practitioners offer free 15-minute calls. Meet one, tell them about your child and engage how you feel to work with them. Engage how you feel to speak to them about your client and your child and see what they say. Just try it. Just dip your toe in and see what comes back. And, you know, it's not that if anything's 100% successful, but I can tell you that we do have a lot of success in homeopathy with healing children and adults, with everybody. And don't be put off by the preconceptions that the world, you know, can give, because this could be a wonderful thing.
Yes, I mean, it's true. I think there's a lot of backlash against homeopathy and other natural healing methods. But I think the beauty of it is too that you don't have to stop doing everything else that you're doing. You don't have to stop taking medication or giving your child medication or seeing your doctor. Actually, everything flows really beautifully together. And I think that today's homeopaths are really well trained to be able to work across the disciplines, like work across, you know, that divide between classical homeopathy and, you know, a conventional medicine, because it's the reality of today. And a lot of patients will come in already with a huge list of medication they're taking. So I think this is important to know, that you don't have to stop doing everything else just to do homeopathy. And yes.
Yeah, absolutely. I think that's important to know, and give it a try. It's not going to be the most expensive form of natural medicine that you'll try, that's for sure. The medicines are not expensive and do no harm, and you know, it's certainly worth it. Don't hesitate.
Beautiful. Well, thank you so much, Sarah. I think that this was a wonderful way to introduce many moms and families to homeopathy, and I hope that it will kind of spark your interest, everybody. And if you have any questions, please reach out, or if you are looking for more help, please reach out and check the links that I'm going to share with you as well in the notes. So, well, Sarah, it was a pleasure, and I really enjoyed speaking with you and learning about your approach. And thank you so much. Thank you, everybody, for watching. And please reach out if you have any questions or need more support. We're always here for you. And we'll talk with you soon on another podcast. Be well. Thanks.
Thank you. Thanks, Monica.